How's that? Can you see me now? Thank you, Ying. Can you hear me now? Beautiful. You gotta love updates and not being informed of them. So they made a slight change, but that's okay. Anyway, I was once giving a presentation and for 20 minutes and no one I was sharing my screen so I couldn't see anything. And finally I get a phone call from the event organizer and she's like, "You've been talking to yourself for 20 minutes and didn't even notice." Yes, I'm that good at it. Anyway, welcome. My name is Dr. Chris Prue. Chris, I am the director of education here at DigitSole, and always good for a story or two. And I'm also a practicing clinician. I've been in clinical practice for over 25 years, and I've also been in higher education and postgraduate education. A lot of my research was in human performance outcome measures and that sort of thing. So that's kind of why I'm here. So this is a monthly, what we call is a reoccurring webinar, and it's essentially is designed. It's product specific. So there's a difference between education and training. This is more sort of on the training side, although I've been told that there seems to be some educational tidbits. So how it works is I use our product, the analysis output, to sort of outline, how to evaluate the data. But one of the things that we instituted when I started this back about 8 months ago was I used a specific case, and so that's why we're going to talk about walking again. We've talked about walking before, but I'm going to use some different examples, and this one I think is kind of unique. And it turned into, oh my goodness, I went down such a rabbit hole, meaning that I started going in a million different directions. So this is either going to go pretty good or pretty bad. I guess we'll see. We'll see at the end. I probably could have made this into about three different presentations, but so this is essentially designed. I don't cover the product itself, how to take an analysis. The target for this webinar has more to do with the people that probably have and utilize the system, but certainly doesn't mean that if you've never used it before, you're not going to be completely lost, because we're using metrics and biomarkers that are similar. If you have an understanding of human movement, then you'll have an understanding of what it is that we're talking about. We're just using a very specific program to be able to accomplish that. So without further ado, the first thing I'm going to do is I'm going to go to a PowerPoint. I don't normally do that, but I just want to highlight a couple of things to make it a little bit easier as we go through. And so, yeah, so we chose this one because we had a lot of requests, and actually, I end up, I've probably spoken to many of you, so I'm one of the people that you may be directed to if you have some questions about the analysis, or maybe some clinical application situations or questions. And so so this will be focused on walk, with a bit of a twist. Like I said, there's going to be a specific application that we always look at, or a case that we always look at. So this one, we're going to evaluate the influence on different footwear. And it's actually something that I looked at really right from the beginning. As like many of you, I'm like, how is this thing exactly collecting the data? And so also, maybe like many of you, I started using it without reading the user manual. I don't know, maybe you didn't, but so some of those questions are answered in there, but I wanted to kind of get a sense of what people might look at. So let's go over to, I'm going to share my screen here, and we're going to go to a PowerPoint. And I'm just going to go to the entire screen because I don't.
Hello, Chris. Hello, everybody.
Hello, Rana's here. Thank you, Rana.
If you don't mind, guys, I will be asking few questions in the on the polls tab. So some very little questions to know you more. So it would be very nice if you could answer those. And for questions, please use either the questions tab or the chat tab. Looking forward.
Yes. Awesome. Thank you. Okay, so I just wanted to show a few slides real quick. And here's the thing. I am going to go quick because I put so much in here. Maybe I'll get confused myself, but like I said, a lot of you have used this, so it's not the first time you're seeing some of this information, but remember that you can go back and view this again, if it wasn't too painful the first time. So let's look at what we got. So when we're evaluating things, because one of the earlier inceptions of what I
It seems that Chris was disconnected. He's gonna join back, so let's just wait for him for a few seconds. Yes, Ying, it seems he got disconnected, so let's just give him a few seconds to come back. This is quite unusual, actually. So you can, and this time you could answer the polls if you can. We really apologize for this. Chris is trying to reconnect, so please hang on with us. In the meantime, please, if you can answer the poll questions, this would help us know you better. Thank you. Thank you, Ying. It's a parrot that speaks nonstop. Hello, Sarah. Okay, so apparently Chris is back. Hello, Ramsey. Hello, Annette. In the meantime, if you have some questions related to DigitsolePro, I can happily answer them by the time Chris is able to connect. If you'd like to know more about it, if you have some specific questions on using, onboarding, on the analysis, I'll try to answer to the best that of my knowledge. If one of you would like to speak, you just indicate in the chat. I will invite you to participate with your microphone or with your camera and microphone. So let me know, please.
Okay.
Welcome back, Chris.
Thank you. Yeah, sorry about that. Livestorm kicked me out, and of course, if I'm not in, then I can't hear anything. So anyway,
Welcome back.
let's get at this again, and I'll move a little bit faster too. So let's do the entire screen. Actually, no, I can't do that either because I have to switch.
Hi, Theodore. I think you sent a message. You're interested in DigitsolePro. So yes, please, you can email us. I'll just add the email here in the
We
chat.
can hear you, Rana. All right, let's try this again. So I don't know exactly where I was left off, but I was describing, this corridor and what this middle line means, and that's going to be the mean. The green corridor is actually what is specific to our system. And this is one of the things that is going to be different. So this is our system and the actual angles that are calculated. We had a colleague, also just recently present a paper. They used Naraxon. The correlation is there. And so this is going to be specific. And this is why, we're having this discussion, because what we say comparing apples to apples, which is, the consistency across measures using the same system, but measuring different shoes in the same person allows me to actually create that comparison. So the uniqueness about looking at it in the shoe is how does that person actually perform in the shoe? And that's kind of our 100-meter sprint is how they actually perform. So what we did, and again, this is I don't know if you heard this part, but one of my advantages is I see patients a lot because I do a lot of rehab. So I get to see, sort of the immediate effect, but also the long-term effect. So this is after correction, right? So the first thing we wanted to correct was that pronation, especially during that foot flat position. And so we see that not much changed here. I was on the treadmill again, but we did change in his cadence. I'll do a comparison between these two. But what you also see is there's a significant increase in his stride length, right? Which most people would think, well, that's because he's walking faster. And the answer is no, he's not walking faster because he's on a treadmill. So what did we do effectively by doing that? So what you'll notice here is we see some widening of the two thin lines, which is the standard deviation. So the motor theory aspect of neuromechanics, suggests that we have to have some variability to be somewhat normal that allows us to control for the changing environment, right? So we saw improvements in his overall trajectory, and we saw an improvement there. Those are sort of the initial acute responses, because this is exactly what I was trying to address. As a result of this, we saw an increase in his stride length, which is important because he had a short stride length, and it also improved his cadence. So this is a performance outcome, which is also going to make him a little bit more efficient. And so this is just looking at these characteristics side by side. But a secondary characteristic is looking at propulsion rate. So propulsion rate is the ratio between the engagement of the plantar flexors and the hip flexors from late stance phase into early swing phase, right? We're pushing off the toes and we're trying to get into that swing phase. So he's bilaterally equal here, and this is a representation where he's using plantar flexors and engaging those more so than his hip flexors. That's really common in older adults because they tend to have a lower engagement because of core stability when it comes to the hip flexors. So the only correction that we did was actually on his left side, and you'll notice that we gave him an opportunity to sort of make that better. And then one would say, well, geez, Chris, you made him worse. Now he's at 14%. Well, we did make some changes. Remember that, we just changed how his body is going to orient, and now he's going to have a shift in that torque response profile as a result of improving that left side. Now his body has to compensate for that again. And I don't have time to go into, what does he look like later, but it actually catches up. So think about it in terms of, when you're having someone do some exercises, is we give them some things to do. And if you were to immediately test them after, like after a run or after, a fatiguing exercise, of course, they're not going to perform as well. That's an acute response, and that's an expected acute response, right? It's the long-term or the chronic response that we also want to take into consideration. So what I did here was I took 4 different shoes, and apparently my wife notified me I have a very large shoe collection because I have a tendency to hold on to shoes for a very long period of time. So, but anyway, I've got 4 shoes here. Up at the top here, this New Balance, it's an extension. I used to wear the Vibram 5-finger shoes, right? Which is, a step above sort of being barefoot, mostly out of protection due to running in the woods and things like that. I have run barefoot, but I like to have a little bit of protection under my foot. But I do really like not having a lot of support in there. And these actually are the shoes I used to coach with on the field in strength and conditioning performance. Then we have a Nike. This is just a casual walker shoe. It has no laces, and so it's not meant to be, overly supportive. It's more has to do with comfort, although there is an element of support to it. I'll get into that in a moment. This is an Under Armour. So this is actually a running shoe. So it's designed to heel strike for people that do heel strike. Obviously, I like low profile shoes. I mostly spend my day barefoot. So I'm pretty good at not heel striking even when I run. But the reason I chose this shoe was I actually tested many different shoes, and this one gave me at that moment in time the best opportunity for a normal gait pattern. And then this shoe down here is a new shoe that's being released later this month, which is why I had to kind of scrape it out because I didn't want to get in trouble in doing that. But that is considered to be a very comfortable yet supportive shoe. And we can see from a top view here, some of the differences that you can see with regards to the overall length. So they're all the same size, except for the one over here. The bow over here on the right is a little bit longer than these other guys, not just in its overall construction, but even in the internal volume as well. So we see this guy here. It actually has a pretty wide toe box because it's stout. It catches, right up to the top of my toes, and I have a pretty good, parallel structure to my toes, so I can get away with that. A little bit pointier here in this more comfortable shoe, but you can see that it's even longer than what's considered to be, I guess, like a snug fitting running shoe. And this is actually the largest of all of them. And then if we look at the bottom here, we can see that in the midfoot design of this Bal shoe actually has the widest. So it has the widest toe box. Secondary is going to be this Nike toe box, which again is a walking shoe. And that's something that you would expect in that particular type of construction. And then the Under Armour being a running shoe, and actually, you can see the wear pattern over here a little bit, is going to be sort of that medium profile. And then again, we see a short, stout, wide profile again on this New Balance, but we see the midfoot here is really, really narrow. So I just kind of wanted to give you a quick overview of the shoes, and then we're going to look at what I did here, right? So this is the online application. I use this a lot, and the reason is because it gives me a little bit more opportunity to look at things a little bit differently. So here's what should be fairly consistent, my cadence and the speed, because I wanted to control that variable. This was all done on a treadmill. And there's another thing that I wanted to highlight too, that when you do use a treadmill, you have to also have some certain expectations. Like it's going to have some degree of control, over things like your step and your stride, potentially your cadence as well. And then the other thing too, is some of that variability, right? If you don't walk on a treadmill normally, it's pretty weird, because if you think about overground walking, you come in contact with the ground and you perform hip extension, muscle force to move your center of mass forward horizontally, right? Versus a treadmill, there's no horizontal displacement of you, slight bobbing up and down, vertical center, but it's the belt path underneath you that actually pulls that forward. That's why in rehabilitation, years ago, we used to have some of our patients turn around and walk backwards, so that way they actually had a different drive pattern, and we could compensate for that. I don't think studies have shown that's completely necessary, but we did it anyway. So what I want to do is just a real quick comparison between. So this is holding on, because I was working on another project too with inserts, and that's going to be a future. So I was looking at the influence, and I made a special template to insert the DigitsolePro sensor inside of the orthotic, and I was evaluating different shoes as well, and that'll be a future release that we'll have in discussion. But so I want to just highlight the metrics again, because some people could be the first time that we're here. You'll notice that I have about a 3.5-inch difference in stride between the right and the left, the right being a little bit longer. And think about that, as we move forward, we'll kind of see that consistency. The cadence is normal, especially for that speed. Let's break it down and look at the advanced, because that gives you a little bit more detail. Sometimes you may not need to go into this, but you can see that the stride duration is pretty normal. The stride length is a little bit short. The reason is that I have the ability to walk with a longer stride, but walking on a treadmill tends to shorten people's stride length in general. The swing time also within the normal, stance time slightly elongated, but also within the normal, partially due because I'm going to be on that treadmill. But that's okay, because I'm using the treadmill for all of these scenarios. We see the gait line is the center of pressure, the trajectory of your pressure as you're going through that stance phase. This is correlated to, so the algorithm that we use is correlated to a pressure platform, and that's where this comes from, and it is relative to the position, but we're not as detailed obviously as a pressure mat. So if that's a requirement, then you would need to take that into consideration. But you'll see here that the loading phase is reduced, and again, that's going to be something that's pretty common, just because walking at that speed is, I tend to walk faster anyway. So I can transition real quickly and safely. 5% versus, the balance here at 3%. So basically at 5%, I'm okay with that. The propulsion rate, it is really designed, if people are introducing certain prosthetics, I think it's used a lot more there, and people are more familiar with it there. It's integrated here because there could be some interesting value here, and I've talked about that in some previous discussions where people that have that strategy where they're walking with a lot of plantar flexion, could be because of low back pain, could be because of core instability, but at 5% versus 3%, it's really not that much different. And even we should don't get overexcited about the color. I know it's red, but it's only a 5%, so it's just we don't have that in between. Let's look at the details. The details actually give us the trajectory of the foot in a shoe as we go through that stance phase. And again, the coloration is part of the artificial intelligence that matches up against the normative data in the literature. So this in particular is ours, but in the walking profile, the spatial temporal parameters, the gait line, the time spent in each one of those phases, clearance, those are actually based against normative values that we find in the literature. The pronosupination is the only one that is based on our particular metrics that we've created the normative data for. So we see that, this is super tight. There's no standard deviation in that stance phase whatsoever. I was holding on at this moment in time. We see a little bit of standard deviation here on toe off, but it's also normal. In patients, I don't like to see this because it means that, man, they're so used to that. There's no variability in there. It's either that they're potentially walking too slow. They've gotten so comfortable with that. We do see, in comparison anyway, I have a slight overpronation in this stance phase. All right. And think about it again, you're in a shoe. And so as more of that block model and that heel eversion position, or reducing that heel inversion, is characteristic. And that's what I'm seeing here. So we'll look at some of the comparisons side by side in a moment, but this is what this trajectory looks at. This is pretty normal here. So your foot progression angle within 2 standard deviations of what's considered to be an asymptomatic population, which if you've heard me speak before, I don't like using that because it means that they're not in pain. Just because people aren't in pain, it doesn't mean they're right, but that's what the literature is showing us, which is -2 degrees up to 14 degrees. Most of us use a less generous and say that foot progression angles probably normal between +2 degrees and 10 or 12 degrees. So a positive angulation means external rotation or abduction or toeing out. Circumduction, this is the trajectory of the leg as it swings out. So this is actually normal. If it was really excessive, there's a couple things that's going on here. They couldn't pull up their foot to clear the ground, so they need a greater trajectory. They weren't using appropriate knee flexion during that phase, or they've got a hip issue going on that they need to swing that out. So there's a few different reasons why it may be that, and you kind of have to, investigate a little bit more for that. We do see, the clearance, and you'll see this consistently. This is just my funny gait. Consistently lower clearance on the right, but still normal, higher clearance on the left. One of the reasons, if you think about our trajectory, one of the reasons that we'll see some differences in that stride. So again, this is holding on. I want to grab and do this comparison. Over here on the right, there are these 3 dots you can click and you can do this compare. It allows you to compare 2 analyses. So that was the Under Armour, and I need to do the Under Armour no hold, which is 1048. This one right here. So this is the same shoe, same speed, same day. As you can imagine, they should be fairly similar. But what happens when people aren't holding on? Well, they have a little bit difference in balance and a little bit difference in strategies. So when I'm holding on, I've got 56.3 and 53.9, 55 and 52. So pretty close, but let's take a gander here and see what might be different. Is we see that we're pretty similar in stride duration between the two. Same thing with stride length, swing time, as well as stance phase. So we don't actually see any differences there. Same thing as we go through and we look at the gait line. I don't really call these a lot, 3% versus 5%. That's a 2% difference in something otherwise. When I start to see 10% or greater, that's when I say, okay, that's going to be something I'm going to take a look at. So let's look at the advance, and we see that again, super tight through here, no standard deviation on that. We actually start to see some standard deviation here. Why? Because I'm not holding on, right? And that would be fairly normal. I want to see that, remember? Other than that, the pathways are going to be very, very similar, and we don't see really any differences between the two. So let's go ahead and look at a couple of different shoes. So I'm going to choose, let's start with the Ballaston. So this Ballaston shoe at 1030 has a very wide midfoot right? And I know there's a lot of foot specialists on here, podiatrists and whatnot. As you can expect, I mean, that to me, that's, again, looking at shoes, because a wide midfoot has greater support to it than, looking at some of those running shoes or sprinting shoes, or the shoe that we saw with that New Balance. So that was the insert BA no hold. So let's look at the no hold of the one that we just looked at, which is 1048. So what we'll see here over on the left, is the Ballaston shoe. Over on the right is the one that we just looked at, which was the Under Armour. So not a dramatic difference in their constructions per se. There's a little bit, less influence on, some of the cushioning effects, because the Ballaston shoe is considered to be an everyday wear. The Under Armour is a running shoe. So we see 57, 54. That's normal, right? Unfortunately for me, is the deviation between stride on the right and the left. So we've reduced by 2 inches on both sides. So that Ballaston shoe actually gives me the ability to have a 2-inch longer stride length, for whatever that's worth. Like I said, I'm not trying to prove to you anything here other than the fact that shoe wear can make a little bit of a difference. The stride duration is off by a difference of about 30 milliseconds on both feet. So that's pretty consistent. But we don't see anything really strange over here in the Ballaston shoe. We do see, those reductions here. So for whatever reason, and I'm not telling you why yet, that more supportive walking shoe is better for me walking at 3.0 miles per hour as far as the spatial temporal parameters go for gait in walking at that particular speed on that particular day, right? But again, this is a running shoe. Maybe running shoes aren't really as good for walking as a walking shoe might be. So let's look at here. We see that pretty similar with regards to the loading phases, but also the characteristics are fairly continuous. In other words, I have a tendency to spend less time on, the heel strike in all of these shoes, I think, is what we're going to see. So that's pretty normal. And again, 83 versus 88, not that much difference. 92 versus 85, so we're looking at somewhere around a 3 to 4% difference. I wouldn't consider that to be dramatic. Okay. Same thing here, 3 and 6, not that dramatic difference between the two. And then, of course, here we're at 3 and 4. And again, to remember that over here on the right, or excuse me, on the left is that Ballaston, that really wide shoe with a wide shoe box and longer. And over here on the right is that Under Armour shoe that we just looked at. So let's click on the advanced and see what it did here. And let me start down here. So remember, this is the one that we just looked at. This was the Under Armour shoe, which was the running shoe, right? And again, it has a fairly thin midfoot section. So if you think about that in terms of, when I'm going through that stance phase and what that might do, well, this is what it looks like. But in this shoe, we see that it's a little bit normal following that trajectory. I have less, pronation or reduced heel inversion, if you want to call it that. And we also see some tightness in here. Both shoes show an increase in that foot flat position, which again, those characteristics are also going to be somewhat relative to what I would expect when I'm walking slower than I normally would, right? But these are two, sort of main differences between those shoes. We see here, it doesn't really affect my foot progression angle, nor would I really expect it to. And we see very similar in terms of the clearance and the steppage, which is, the toe off, clearance, and then the heel strike or the attack angle, right? They're very similar. These are in the yellow because, again, remember that I've got a slightly shortened stride for the speed that I'm actually walking at. So let's go ahead and do another comparison. So I'm going to leave the Ballaston shoe up because we've already seen the Under Armour twice. So let's pull up and look at the Nike, which is sort of in between that running shoe, and Nike No Hold is 1054. So it's sort of in between that Under Armour running shoe and that white shoe, the Ballaston. Only 1% difference in contact. We see 57.54 and 57, almost 54. So very, very similar between these two guys. And I would expect that because they're actually a very similar construction. And man, don't these look exactly the same? So they're both shoes built for walking. So I would expect that, and that would be normal, right? And this is sort of a plug, when we're looking at inserts or orthotics, should I be using the same ones for walking as running? Just a thought. We see, again, very similar going on here, slightly higher in the 8% here. I will say that I don't like these shoes. I don't, they're weirdly not as stable for me. Especially walking, and I don't know what it is. I haven't really gotten into the construction of those. I haven't had them for very long. They were given to me as a gift. Okay, so this is the Ballaston shoe right here. Pretty normal. I'd like to see a greater standard deviation here during the foot flat position, but given the speed that I was walking, not very challenging. Well, but then we look here, and so not a bad trajectory, but we see, especially in toe off, we really start to open up, and the standard deviation becomes quite excessive. And so we actually have a standard deviation of 5 degrees, and that's large, right? So typically when someone has something outside of that normal standard deviation, they might have pain. It could be a motor control issue. It could be it changes the mechanics and actually has a structural influence on their ability to complete the task. And in this case, it's actually going to be toe off. And I have nothing against Nike. I think they make, quality shoes. I've never been a real big Nike wearer. And maybe I'm biased. I don't know. But anyway, so far, this shows me that the Ballaston is probably the better shoe, at least for that walking, right? At least in that stance phase. Other than that, we see characteristics, very, very similar. So because we saw Ballaston as kind of the go-to as far as being most normal, let's look at that New Balance. So the New Balance is a low profile shoe. And let's see where I got that. New Balance hold is 1059. Okay. And so we see that the New Balance, it's consistent from right to left. In other words, this is the symmetry characteristic, which is stance phase. Again, I'm walking at the same speed because I'm on a treadmill. Cadence is also very, very similar. This is the Ballaston, so we're at 57.5 and 54. Now we're at 55 and 53. So we further, we're reducing the stride length on both of these guys. It's getting a little bit closer between the two, but now I'm getting a little bit shorter in that. So let's break that down and look at all of it. So very similar in terms of the stride duration. I'm starting to approach, that lower stride length, especially on that right side, which we consistently see. Now I'm starting to get a slower swing time that might have something to do with propulsion and toe off. We'll have to take a look at that and see what we got. Stance phase, again, very, very similar. So that means the differences, have to do with when I'm in the air, that swing time, and probably partly in that toe off. We see the trajectory going through the center of pressure, the gate line here, again, being very similar, same characteristics. I load quickly and then go into foot flat and remain there for a slightly extended period of time. Again, not a lot of difference here, and I really wouldn't expect a whole lot because There's not a lot of difference in some of those other areas in terms of strategy. So let's look at the trajectory. So this again, this is the Ballaston shoe. Pretty normal. Like I said, again, I would love to see this open up a little bit. And the other thing that I tend to do, like if this seems slow to that person, or if I'm using walking as a way to perturb or tease out part of their problem, right? You have a couple options you can perform. Um, Either like a dual task, you have them do something else while walking at the same speed, or as we also call this, a stress load change, 3 miles per hour or 5 kilometers per hour, and then go up to 8 kilometers per hour, for example, or 3 miles per hour and go up to 4.5 miles per hour, and then see if there's going to be some abnormalities there. And again, what would you expect? I would expect to see some differences because, for example, a 10% change in gait with regards to running dramatically changes, a lot of those characteristics. So what do we see? It doesn't look as nice, and right. So there's no midfoot support, right? And someone may say, well, yeah, you might want to change that. And in all honesty, I had stopped wearing those shoes a lot. And in fact, I was wearing these other types of shoes more regularly. And that's actually why, when I saw some of this data, I went back to, doing some specific strengthening exercises because I wanted to see if I could do this without an insert, without correcting that. And so that's what we've been working on. But what do we see here? We see, fairly normal heel strike, which we saw very similar angles on a lot of these, but yet I transition by 10 degrees once I heel strike into that foot flat position. So I dramatically reduce that heel inversion, right? And I'm approaching even neutral. And I do that on both sides, even a little bit more so on that right side. And then the problem on that right side, I continue that trajectory and I approach zero. And then that actually seems to make it difficult for me to actually supinate, right? So now I'm going back into that position and again, I mean literally supinate at the forefoot. In this trajectory, what we're seeing here is I'm not moving back and I'm actually shifting and I'm not getting the appropriate transition onto the first and second ray while wearing those shoes, at least while walking at that particular speed. So that's the biggest difference between that. Now, let's say, what if I wore these shoes for a long period of time? What do you think might happen to some of these other characteristics, these other metrics and biomarkers? That's what, again, I try to predict in patients is when they show a profile like this, I'll say, well, if that's the shoe that you're wearing for this environment, this particular goal, this particular reason, it's it may not be your best choice. So we either need to choose a different shoe or we might want to correct that shoe that you just maybe spent a lot of money on, right? We see normalcy in the foot progression angle. And again, these angles all seem fairly normal. So just to sort of summarize this, this was an exercise in, um, this was an exercise in looking at different shoes. I wasn't trying to impart, any sort of clinical evaluation, so to speak, but how we utilize that to evaluate footwear, or like the example I was showing right from the beginning, which was actually correcting that and then looking at, well, what is the influence? And so the potential, influence is I then have to look at the performance-based outcome measures, because imagine if they were completely bilateral and maybe the system shows that someone is overpronating and we correct that. If it has a negative influence on those performance, it starts to cause them pain. Well, unfortunately, that was just the way that they were kind of made. And who are we to sometimes make those changes? The other thing too, like I I sometimes do analyses for people and I don't have the background information. And that's really important too. Like, what else is going on? Are they experiencing back pain? If they're an athlete, are they performing worse than they were before? What are the other factors associated with that? Because imagine if you had a Paralympian who has cerebral palsy and you saw that profile and you tried to correct that, it ain't going to happen because that can't be corrected, right? And so that's a really good example of looking at, these performance-based outcome measures. So I am going to stop there and let's see if we have any questions.
Yes, Chris, there are a couple of questions from Ying in the chat tab.
Let me see if I can find the first one. So
I can read them if you want.
Yeah, I'm trying to find the first one. Okay,
The
generally
first one is from Ying. That's it.
Yeah, okay. Generally, I give my patients 20 minutes walk to get more data. How long? Yeah, I 100% agree because you need enough data points because maybe they're just getting warmed up and so a couple things, like especially in the running and in the jumping, I always have them do some warm-ups, right? Because in research, we found that we did warm up, and then even after warm-ups, we found that in vertical jumping, for example, 85%, 80% to 85% of people do best on their second trial. 10 to 15% do best on their third, and only about 5% do best on their first. And so that's why, having a few more data points. So with walking, the system requires a minimum of 30 seconds. I like to do a minimum of at least a minute after I allow them to warm up a little bit. Now, I've gone so far out and I've had people run 10 kilometers. And so the reason I go longer sometimes is if I am looking at maybe you take someone who has patellofemoral pain syndrome, and a lot of times that really doesn't show up until they seem to be able to get into their first, 2 kilometers or so, 1.5 kilometers, and then they start to experience the pain, is I can actually click and look at that moment in time and compare even that moment to an earlier moment or a later moment. With the walking, it's a little bit different. It's all aggregated and we get a mean. But so I like to do a minimum of 1 minute. I think somewhere between 1 and 3 minutes gives us the majority of the data that we have. The other, if you go too long, because some of us have patients that, they don't walk too far. I was just, having a discussion with some folks that, we're always having more opportunities to be able to do less. Right now, the grocery stores, the supermarkets can get all the food for me. I don't have to walk around anymore. They can actually deliver it now. And I mean, it's crazy. So some people do not even walk that far. So I would say, if your patient population can do 20 minutes, then, that's fine, especially if you're looking for that. But in general, I think, and Rana may know the answer to this as well. We have found that the largest percentage of the people that are collecting data with our system are spending between 1 and 3 minutes collecting a walk or a run. All right, Mayor, how do you pronounce that? Kensu? Does that sound right? I hope that's right.
I think Jansu.
Okay. I'm American. We're horrible. May I request a copy of the slides or request? Yes. So the presentation is recorded and it's going to be available to you. I believe you'll be sent a link. In the clinic, does it mean that I have?
It's the same link the people use to access the event. The
Yes.
same link you received by email would allow you to access the video replay.
if you'd like to have a YouTube link, you could just email us and we can send that to you together with the slides. Yeah.
Yes. In the clinic, does it mean that I have to assess my patients in different footwear? It depends. So here's what I normally do is I say, please bring in the pair of shoes that you wear normally to do whatever. And I can take that one step further and say, or also when, you know, because in industry, sometimes they have to wear very specific shoes, like a steel toe shoe or something like that. So I can test them in their shoes like that, and we can correct that shoe to walk normally. And then the other one is, you know, bring a shoe that you might do your walking, your exercise in, or something like that. So I may have people bring in a couple of different shoes, and we can evaluate their shoes and correct their shoes if necessary. But that's also where you're going to be able to link and say that your footwear may be related to something that's going on. Like if you're wearing a shoe that doesn't give you the appropriate performance, it may actually be causing your low back pain or your knee pain or something like that. Hey, Ramsey. Is it not the case that during propulsion, when walking, the gastrocsoleus complex have reached maximal volitional contraction, which is MVC, at heel lift? And that is being measured as the activity of the long flexors plus the momentum being produced. So yes, there's multiple ways that propulsion rate can be calculated. And one of the best ways to do that, and in fact, the ratio is calculated between muscle activity pattern. We're not using surface EMG, so we're using acceleration, and that's actually one of the potential limitations. So our calculation is an algorithm that is calculated based on in our lab using EMG for muscle activity patterns. On the other side of that, there's also some, potential limitation in general, just using EMG and actually they're using Meccano might be a little bit better for that. But you are correct, and so we can evaluate that a few different ways, and that's why I don't get overly hung up on that. And even in the literature, it's sometimes comparing apples to oranges or two different orientations or calculations because of how people have actually calculated that. And even, for example, was it normalized? And what was their overall calculation with regards to how they did that? So propulsion rate is something that I find very, very useful when there's those large deviations. I think some other people that actually maybe do a little bit better job at actually calculating the mechano muscle activity or the electromyographical activity, using it specifically for looking at the engagement or lack thereof in terms of. So for me, the way that I look propulsion rate and why I'm not as concerned with looking at actual muscle activity, per se, is more from that strategy standpoint and how is it influencing the outcomes of some of these other factors, like the amount of time that they're spending in toe off, and relating that propulsion rate may have some explanation as to what's going on. Is it low back pain? I also use electrostimulation. There's various types of devices that if you actually measured a reduction in, muscle activity patterning, then, you can correct that. And we can also use that sort of diagnostically to see if that actually changes their propulsion rate. So what is the data measured? So is that data measured over time or at a single point in the swing phase? It's at a single point. So it's measuring maximal acceleration at one specific point. And that's how the algorithm is generating that overall propulsion rate. Actually, I saw cadence and step distance are a measure of comfort or performance or both. Cadence and step distance are a measure of comfort or performance or both. Yes, yes, and yes. So here's the challenge is when you're on a treadmill, we're impeding someone's ability to sort of hit their maximal performance. Because if I force someone to walk slow or fast, it's going to have an influence on their cadence. So typically, the way that we do it in the literature to control um, in research, I should say, is actually not on a treadmill for this very specific reason, Theodore. And so we use what's referred to as self-selected speed or comfort speed. When we do that, then that cadence and step distance are a measure related to comfort. And then we can sort of superimpose that, or we relate that to, well, what exactly does comfort mean? It typically, to that individual, it means that they're not overstressing their cardiovascular system or their neuromechanical system. So people that have challenges with balance will tend to have a slower self-selected speed of comfort, because when you have to walk faster, it requires, kind of like what we were just discussing with Ramsey, it requires a difference in muscle activity pattern, which is one of the differences in using EMG versus using acceleration or velocity. Initially, is it requires more muscle activity to perform that particular feat. And so people that do that, it throws them off balance. Also, when we're looking at the incorporation of hip flexors, if they have something like low back pain, for example, then they're also going to choose a slower selected speed. So the performance piece is, we also have another level which we actually force people to walk faster, and so we call that fast as possible. And so we make people do that to see what that sort of characteristic teases out. In the normal population, there is a correlation sort of between those two. In the population that many of us might deal with in the clinic, it's sort of it gets worse. And in fact, we could put them at danger of falling. So even that's why, again, someone would walk slow if they have they're a fall risk, but as they have a fear of falling. So something to certainly take into consideration. So it's a little bit of both, and that's why, again, sometimes I'll use a treadmill at 3 kilometers per hour, 3.5 kilometers per hour, 4 kilometers per hour, and then use a stress. So for example, I had an athlete with low back pain. I like to use gait, as you can imagine, to evaluate. She, at 5 kilometers per hour, which is kind of the standard that people should be able to walk at, especially a young person, it was normal. She was able to compensate for that. But once I started getting up to 8 kilometers per hour, that's where we started to see the asymmetry patterns on that affected side. And so that allowed me to sort of tease that out. And then especially, if you have a runner, I still do a fast walk even before I do the run, which is sort of considered that performance. Let me go back to, I think, Ramsey. All right, so I think that was it. Again, I kind of apologize because this is probably a little more technical, and there's a little bit more variability in this because it was just kind of an introduction to what happens, when we test different shoes, and it was challenging to get into, a lot of interpretation, but hopefully this was beneficial in, giving you some sense of, one is, do we need to assess, shoes like Ying had asked? And the answer is there might be. And then the other question is, well, can I actually use shoes as sort of a method of improvement? So there's a couple interesting studies on treating low back pain, and that's exactly what they did. Was they didn't do anything. There wasn't any rehab. There wasn't, basically they evaluated gait pattern and they did something to correct their gait. So once they found out the different inserts or things that corrected their spatial temporal parameters, that's all they did, right? And had a statistical significance on reducing low back pain. And that's kind of the way I look at shoes too, is it potentially has a corrective opportunity to it. But again, I think it also has an opportunity to hurt people because, you know, especially maybe as they get weaker and older, you know, that their footwear may have a negative influence on, you know, their overall mechanics. And Ramsey, I think you already asked this, but this and that single point in swing phase, I think I said was maximal velocity. And I think that's about it. And I think we went over time a wee bit. And let me just go back to that question again. Ever used a metronome? Oh, sorry, I missed that first question. Ever use a metronome when reviewing clients to ensure that they have the same cadence as before? Yeah, that's a super good question. So one way to do that is using a treadmill. It has the same speed, but using a metronome actually is a little bit different, right? Because it calls into play, and we actually use that, Ramsey, as a method of biofeedback. So, for example, you have an asymmetrical stance phase and an asymmetrical swing phase. So you can actually use a metronome to get people to normalize. And so the downside of using that when I'm evaluating them is it may cause them to normalize, and I may not see exactly what the problem is, but you could certainly use that to force them to correct and sort of see that difference. And that's one of the reasons that I use a treadmill. I worked with a lot of projects, and we're using a different portable system for gait analysis in looking at stepping. So marching in place for people that didn't have the equipment to actually do a gait analysis, either, you know, on a treadmill or walking, where most people do a gait analysis on a treadmill unless you have a really big lab. So could we correlate marching in place to walking? And there is a pretty big correlation. And one of the things that we worked on was we used a metronome because we wanted to see if it made a difference in correcting them. And it did make a difference in correcting them, but it was sort of like, again, asking someone to walk in a pattern that they may not normally do because they don't have that normal level of symmetry. All right. Now we're way past, but remember the drill. Rana said that this will be available in recorded, and if you need a certificate, to email us. And what else? I think that's about it. So,
and if somebody has suggestions for a future topic, or they have a specific case they would like to inquire about, or just talk to you, Chris, or ask some questions or share, they're more than welcome. You can email us at education@digitsole.com. I've included the email early in the chat, or you can email me, and my email is there as well.
Yeah, and make it easier. This one was hard. No, this one, I love this stuff, in case you haven't picked up on that. And that's, you know, and I think Andrea just wrote, you know, that sort of variation and insight is, you know, it hopefully as we share these things, and they're not all my ideas, that's for sure. I'm not that smart. Is, you know, we look at things different, and we get to pick up some things that otherwise, you know, we may not have been thinking about before. And so that's I think it makes us all better, and it does a better job for our clients and our patients. So have a great evening, afternoon, morning. We will see you in about a month, I hope. But if there's any questions, like I said, any interactions, please let us know, reach out to us. And, you know, I love to hear different cases and things like that. And for me, this is the first day since I think maybe November, that it's actually warmer outside than it is inside. So I am looking forward to getting outside today and start to enjoy spring here in New Hampshire. So I hope the rest of you have a wonderful day, evening, morning, and we'll see you soon.
Bye, everybody.
Take care.